Welcome to Innovations in Clinical Implementation. This is the BWH Lab A4M series of podcasts that's dedicated to translating emerging evidence into practical tools that you can use in clinic on Monday morning. We're recording here at Longevity Fest live. If you're here, you can listen outside, but we're surrounded by thousands of clinicians, 8,000 or more, I think, is the total number we've heard. And they're all committed to advancing longevity, immune resilience, and functional medicine. My name's Jessica Carter. I work with BWH Lab as the industry collaboration specialist, and I'm also a registered dietitian and certified functional medicine practitioner.
I'm Chris Adamo, an epidemiologist by training, a partner at BWH Lab, and I head up the research at BWH Lab, and we're happy to be here today with Dr. Jill Carnahan to explore the science and real-world implementation of beta-glucan as part of a comprehensive approach to improving immune function and supporting healthy aging. Dr. Jill is a functional medicine physician, breast cancer and Crohn's survivor, and founder of Flatiron Functional Medicine in Boulder, Colorado. She's internationally known for helping patients uncover root causes of complex illness and for teaching clinicians around the world how to apply personalized integrative care in practice. So, welcome, Jill.
Thank you. I'm excited to be here with you both.
Awesome. So we're going to kick off and talk a little research, which I know you're very well versed in this topic. So when you look at the research on beta-glucan, what stands out as its most compelling role in supporting healthy longevity?
So I was just with A4M in Geneva, Switzerland, and there were so many amazing people talking about stem cells, regenerative medicine, amazing new things that are coming out in science. But I got up there and told them immune system, immune resilience is the foundation of longevity. And to me, the research on beta-glucans just backs up that statement, because if we don't have a healthy immune system, we don't have longevity.
100% immunosenescence and so on. So I'm going to turn this one over to Jessica.
Well, for those that are new to your work, what really differentiates BWH Labs beta-glucan from other forms that are out there or other options?
So years and years, I've used beta-glucans for years, but what has really impressed me is there are several studies that literally compare what is out there. And the studies have shown that, literally 30, 40, off the top of my head, times the efficacy for the same dose. And then talking to the founder and director of the lab, I realized that purity matters. And so they're sourcing, and to me that matters as a clinician, because I'm not in the field looking at sources of my materials. So I trust that my providers of the supplements that I use in clinical practice have actually done that. And the sad thing is not everyone goes to that extreme of getting quality and purity in their products.
And the fact that there's published peer-reviewed research comparing all the different products is incredibly needed and really valued, I think, for beta-glucan. So clinicians can know, hey, look, the BWH Labs product is this much more active than other stuff that's out there. It's really
and you
cool.
can pull it up and look at the comparisons. It's really quite impressive, because there's very few other supplements.
That's what I was going to say. Yeah. We had that for others too.
Yeah, me too.
So aside from purity, we know from an immune resilience perspective, how does beta-glucan influence aging physiology? In other words, what's happening inside the body?
Yeah, so like I said, immune resilience is the future of longevity medicine. And the reason that is because we're slowly having these undifferentiated T cells that start to become differentiated, and then they're sluggish, they don't do the right thing, they put out excessive cytokines. And we saw this especially since the pandemic, because that was one of the triggers to immune dysfunction in many otherwise healthy people. So I really think that understanding the aging process as an immune process at the core, among other things, and you can see the Hallmarks of Aging study brings us out as probably 5 of the 12, if not more, relate to the immune system and the cytokines. So it's a really powerful way to reverse aging through the immune system.
Well, in thinking of that aspect of kind of who would you work with? What's the ideal patient to use with beta-glucan when your goal is to improve immune resilience or supporting healthy aging? What type of patient comes to mind in practice?
Yeah, Jessica, that's what's so exciting, is really all ages. It works well for, and not only humans, but fish and mice. And you name the studies, there's a lot of. In fact, I was always surprised when I was researching for a presentation recently, this has been used in animal food and livestock food forever, because they see that even in animals, it improves their immune systems. So the exciting thing is it really applies to many different ages. And my complex chronic patient population with tick-borne infections, Epstein-Barr reactivation, weakened immune systems from other reasons, cancer, inflammatory bowel disease, they all benefit.
Well, and you just listed a lot. So is there anybody that you're concerned with beta-glucan? Is there any cautions that you take with that?
It's pretty universally tolerated and can be used in all ages. The only question out there is if someone has anti-Saccharomyces antibodies, could there be a contraindication there? And I don't know that we know the answer yet.
Yeah, sure I do. Well, if we look at longevity and health span, we get our foundational things like nutrition, movement, stress management, and sleep. Where do you feel that beta-glucan fits into that sort of matrix?
I love that question, Chris, because I feel like I'm a purist in the sense that so many, even great functional doctors, like I said, this longevity conference, everybody's talking about the fancy, expensive things, and we forget movement, exercise, and sleep, and stress. So always those are foundational, and I never want to replace that with a pill or capsule. However, I think beta-glucans will be right there close and nearby once you have the foundations down, because you're going to prevent illness, you're going to fight cancer, you're going to do all these things that the immune system is supposed to be doing for us.
Yeah.
Thinking of bringing this into practice, could you talk us through a brief case that demonstrates how you would integrate beta-glucan in, like maybe a protocol that you might use or dosing recommendations?
Yeah, so two things come to mind, and I think it's worth mentioning both of them. One example would be a 24-year-old male that I recently saw with Bartonella. He had a parotid gland enlargement. He had a history of OCD and anxiety and a lot of the neuropsychiatric symptoms with Bartonella. And he tested positive with FISH, which is in situ hybridization, a pretty standardized test that's very clearly positive. So when we treat someone like that, we want to obviously treat the infection, and that might involve either herbal drops in his case, or in other patients, antibiotics like clarithromycin or rifampin. But what I know to be true with Lyme and co-infections like Lyme, in this case Bartonella, is that there's no amount of herbs or antibiotics that will completely suppress that infection, and you must get that patient's immune system to work alongside and get more activated, because often these Borrelia and Bartonella will actually be immunosuppressive, so you're kind of this double-edged sword, and by just treating them without helping their immune system. So that kind of a patient, I will always put on beta-glucans. I would do anywhere from 500 to 1,000 a day, and they tolerate it well, and it to me, it's part of the protocol. The other case that I mentioned is, and this would be a patient, 36-year-old with breast cancer, young person, and pretty much all, because of my history with cancer, I tend to attract some of those patients that have, early onset breast cancer or other cancer types of illnesses, and this to me is one of those absolute, first time I see them, let's get beta-glucans on board, because you need those T cells and natural killer cells to fight cancer.
And those aren't aware too, there are dozens of clinical trials, studies in humans of beta-glucan for various cancers, which, a lot of times we operate on biological plausibility. This supplement, this whatever might help with cancer prognosis, but there's actually, clinical trials on that. So it's a really, just a demonstration of just how powerful these can be in supporting health.
Yeah.
Well, and talking about that, thinking about these kind of chronic conditions and really extreme conditions, I also think about what I see in practice, which is, as a registered dietitian, I'm getting people who are just trying to do a few things better. And I find that beta-glucan becomes that foundation that we have to start with, even before we move into other things, because they're not well, and they're fighting illness. They have a lot of stress. I know the research supports beta-glucan for stress and just the everyday use of it. So I think it's great to see a product that goes from, very advanced cancer support, things like that, to just like a busy mom that just she's run down. So
one of our bestseller was what has been beta-glucans for the winter months, right? Just because people want to stay well and fight viruses, and their whole family gets sick and they want to stay well.
Conference like this, traveling, this kind of stuff, for sure.
Exactly.
Yeah, and I use it with a lot of high school
athletes,
clients, that I'm working with, but especially athletes, because they are trying to stay in their season and they're trying to stay well with that, and they're trying to avoid injuries. There's so many things that they're working on, but just it can put it back so far. So, so what are your pearls for success with this? Like when you're thinking beta-glucan, but maybe beyond in the longevity functional medicine space, like what are some things you could give clinicians as like takeaways or really highlights that you would want them to think about beta-glucan, like I said, but just the use of it in immune resilience and immune resilience as a concept?
I think I'll frame this in the kinds of things I get from clinicians question-wise, because I treat obviously complex chronic illness, and my framework of functional medicine is toxic load, infectious burden. And what happens is toxic load weighs down the immune system, and so you see this immunocompromise of some form, and old infections like Borrelia, Bartonella, Epstein-Barr, CMV, varicella, you name it, are starting to pop up. We also saw that post-COVID. So we're seeing more and more and more patients who have a toxic exposure like mold or something else, or an infection infection after COVID and they never get well, and then their immune system really crashes. Now, the pearl here is I'm actually testing T cell function, B cell function, natural killer cell function. I'm doing lymphocyte maps. I'm doing actually mapping out the lymphocytes. So to me, this is such an obvious choice because I can see the before and after when I treat someone with beta-glucan. So I can literally see the CD4, CD8 ratios and what we see with aging populations, and also these younger people who have immune dysfunction and toxic load. And even though my area of expertise is mold toxicity and toxic environmental exposure, this is so critical because one of the number one mycotoxins I see is mycophenolic acid, which is Cellcept, a drug we use for transplant donors or receivers. So it's an immunocompromising mycotoxin. So it all fits together because I feel like with toxic load or infectious burden, which are the drivers of immune dysfunction, one of the only ways you can get movement with that is something like beta-glucan, and then sleep and exercise and the basics.
Yeah, right on. You talk about the toxic load. There's some interesting data that actually beta-glucan helping get rid of some of these toxins. PFOAs, like forever chemicals.
Let's talk about that really quick because it's so awesome.
Yeah.
And when I heard the studies, I think it was the interview you and I did about it being actually a polyphenol in the gut and actually somewhat of a binder in the gut. And obviously with toxic load, we're using the phase 1, phase 2 liver, excretion of the bile, and then those bile acids, and we need to actually have them move through the gut. And so I think that is another powerful way that is unexpected that it really works well for my patients.
And what's super fascinating on top of that, and you're going to be talking about this, the clinical trial that we recently ran on the BWH Labs product showed a number of different pathways for detoxification. So the 1-carbon-metazoline type of stuff. So I think there's even more mechanisms that we're finding out how beta-glucan can help rid the body of these toxins that suppress immune function and a lot of other things too.
It's exciting to have a product like that that has such a benign profile where there's not many people that can't take it, and also such a across-the-board powerful. And especially in, like, when you think about, again, my specific population, it is the toughest of the tough. People who've been everywhere, and they're the perfect candidates for beta-glucans.
You're doing such great work.
Thank you.
Yeah, absolutely. Well, I guess I should ask, because you both are so familiar with the study, is there anything we want to share about the study that is exciting that would get conference goers here excited about to go listen to you talk about it tomorrow, or anything to watch
today,
for?
I believe.
And you're talking about it today.
I'm just going to say, go see Ryan and Chris.
Right.
I would say, and you can expound because I just heard the little snippet of what it was, but the surprise was the anxiety depression scores improved.
Right.
And of course, immune system, when I used to talk about depression and lecture on mental health, it was all to do with the immune system in the gut, right, and cytokines. So it makes perfect sense to me of how something that suppresses the immunoinflammation, which causes excessive cytokines, would also improve mood. But was that
that was one of the main ones? Yeah, that was really interesting. Lower inflammation, I think, was interesting too, because we know that beta-glucan in the short term will increase the activity of cytokines and so on, which you want to fight an infection. So there's this question of what happens over the long term. We actually showed pretty definitively in this with the True Diagnostic, which is just a wonderful test that shows all these pathways, that a lot of the inflammatory pathways were down regulated. So actually with anti-inflammatory over the longer term. So that was pretty interesting as well.
A note on that, I think it's worth being real specific, is a lot of people are like, what do you do with autoimmunity? Well, basically like Crohn's or colitis, right? And the data supports that not only does it increase immune function, T cells fighting infections, but decrease autoimmunity, which is a pretty amazing combination.
It really is.
Yeah, definitely a good call out with that. Well, lastly, what are you excited about here at the conference?
Oh boy, I just love seeing everybody that I know and love, and the energy is always great. It keeps getting bigger every year. I think longevity medicine is really on the forefront of some amazing things. And I think it used to be just drugs and supplements, which are amazing. And I think there's going to be more power in energetic therapeutics. And I want to just learn more and more about that. So light and sound.
Oh, yeah, big time.
Yeah.
Yeah, we have conversations about this all the
We just got to talk
time.
about light.
Yeah, exactly.
Yeah, it's the future of medicine.
It is, yeah.
The physics of medicine.
Yeah.
Well, we appreciate this. Just for our viewers, be sure to check out the resources that BWH Labs has put together for this episode. So there's a protocol, there's a webinar on there, lots of fantastic tools to use in practice. There's a QR code if you're here at the conference, and you can scan it out there. Otherwise, it will be on the landing page when this episode is released. I did say finally, last thing, but if there's one more thing, is there like one, if you had to give one takeaway to clinicians, besides take beta-glucan or integrate beta-glucan? What would it be?
Well, I've already decided that my 2026 is going to be talking about immune resilience. So I think the future of medicine and longevity is truly understanding immune resilience.
So focus on immune health.
Mm-hmm. Yeah.
Yeah, it is a hard one to, we don't measure it very easily. I'm glad you talked about that. So it's a hard one to wrap our head around, but I appreciate that. Yes. All right. Well, thank you so much.
You're welcome.
Thanks, Jill.
Yes.
Immune resilience is foundational to performance, recovery, and longevity. Beta-glucan has been studied for decades for its ability to support innate immune activation, helping the body respond intelligently to stressors. Not all beta-glucans are the same. Structure, purity, and source determine activity. That's why we focus on one clinically researched ingredient, BWH 85 beta-glucan. Explore the science at bwhlabs.com or find us on FullScript.